name is Walter Huda. I'm a medical physicist, and I currently work in the radiology department at the Medical University of South Carolina. I've been interested in radiological physics for all of my professional life, and I have written a book entitled Review of Radiologic Physics that is used by many residents in radiology who are preparing for their certification examinations. And in the summer of 2011, I published with my co-author Kerry Green Donnelly a book entitled RT X-ray Physics Review, which is a review of radiological physics designed for technologists such as yourselves. The title of the whole presentation is Optimizing CT Image Quality. There will be 6 parts, each of which is recording length of a nominal 30 minutes. Parts 1 and 2 will talk about the important issues of radiation dose and image quality in CT imaging. Parts 3 and 4 will address 2 software packages that are available on your CT scanners. One is called CareDose 4D, which regulates the amount of radiation used to perform the exam, and the second, CareKV, which regulates and controls the X-ray tube voltage. And the final 2 presentations will be about the clinical aspects of the work that you do. One will talk about the techniques that you should expect to encounter, and the final part is the clinical experience, what you should expect to encounter as you scan your patients using CareDose 4D and CareKV. We have arranged for you to get CE continuing education credits from the American Society of Radiological Technologists. To do this, you will be given 40 questions at the completion of the course. To get the credits, you must get at least 30 out of 40 correct, that's 75%, and you have up to 3 attempts to achieve this passing score. Part 1, that I'm going to cover now, will address the issue of radiation dose in CT. We will talk about something called the CT dose index, which basically tells you about the amount of radiation you're using in an exam. We will discuss how the magnitude of this CTDI dose index is related to the technique factors such as X-ray tube voltage and tube current that you select to perform a given exam. And finally, I will explain how we can take these CTDI data and convert them into what I hope you're really interested in, which is the amount of radiation your patients actually receive. So, we will start with the CT dose index, the CTDI. And the CTDI is obtained by making measurements in acrylic cylindrical phantoms as shown here. You have a cylinder, there are hole locations in the center and in the periphery, and into one of these hole locations you can place an ionization chamber. It's shaped like a pencil, so physicists talk of it as a pencil-shaped ionization chamber. And in this particular slide you can see in the central location of the phantom with the white arrow the location of the cylindrical phantom. Now when your physicist or the manufacturer make measurements of this type, they will report a couple of numbers. One is called the CTDI vol, which is the volume CTDI, and the second is a DLP, which is a short name for the dose length product, hence the DLP. CTDI vol measured in milligray, normally written as CTDI subvol, depends on the X-ray tube voltage you put across the X-ray tube. It depends on your choice of X-ray tube currents. It depends on how quickly the X-ray tube rotates around the patient and completes 360-degree rotation. It depends in Helical CT on the CT pitch DLP, and it also depends on the size of the phantom in which you make your measurements. And as you will see, the phantoms come in two sizes. The small one notation is S, and the large one with a notation L. Now, CTDI vol, let us suppose that you're doing a scan. The scan is of the shoulder region here, indicated in light blue. You select your techniques, you press your start button, and away you proceed with your scan. And your scanner will now indicate that CTDI vol is 15 milligray. That is telling you about the rate at which you're putting energy into the patient. But it's important to remember that this number, this 15 milligray, is independent of scan length. And if you were to do a chest CT scan or a chest abdomen pelvis CT scan as indicated on the right, CTDI vol would not change. And because of this, we have a second number called the dose length product. And the dose length product is obtained by taking the CTDI vol value and multiplying it by the scan length. The units have to be milligray centimeters because CTDI vol is in milligray and the scan length is measured in centimeters. And so the CTDI is the rate at which you put energy into the patient, and the DLP, the product of CTDI vol and the scan length, is related to the total amount of energy that you are putting into the patient. So to summarize, we have the CTDI vol, which is the radiation intensity you're using, the dose length product, which is the total radiation used to perform a CT scan. And if you as CT operators are interested in these numbers, you should be, where are you going to obtain them? And the answer is, at the end of your exam, there is a dose summary sheet, and I have an example from a Somaton definition flash CT scanner, and down at the bottom you have an array of technique factors. And I just want to illustrate what you can expect to encounter for a typical head scan and a typical body scan. In your head scan, the summary sheet will tell you the KV that you used. It will tell you the MAS that was used, in this case 390 MAS. It will tell you what the CTDI vol value at this KV and this MAS value on the definition flash, it would correspond to 60 milligray. And notice that there is the letter S, and it tells you that the measurement, the CTDI vol, was obtained in a small 16 centimeter diameter phantom, and by taking into account the scan length, you get the DLP, in this case to be 900 milligray centimeters. So you now know how much radiation was being used to perform this head CT scan. Let's look at an abdomen scan. The KV might well be 120. The MAS that was used to perform the exam in this case is 90. The CTDI vol is 5.1 milligray. But notice that there is the letter L after the CTDI vol value, which indicates that the measurement was made in the large, the 32 centimeter diameter phantom. And by taking into account the total scan length, you now have a representative DLP for this abdominal CT scan of 125 milligray centimeters. So let us now turn our attention to the important topic of how big is your CTDI number. And the size or the magnitude of CTDI depends on your choice of techniques, and it will depend on the size of the phantom in which the measurement is made. In axial scanning, it is dependent on your choice of MAS. In helical CT, it is dependent on the effective MAS, and we will explain what we mean by this term shortly. And in all of CT, it is dependent, and independent in a large way, on the selected X-ray tube voltage, the KV value itself. Now, in terms of the CTDI phantoms, we have two sizes. There is a small one, 16 centimeters in diameter, that is nominally taken to be a head phantom. There is a large one, 32 centimeters in diameter, which is taken to be a body phantom. Now, the only important thing about these two phantoms is that you bear in mind that if you make a measurement in a large phantom at a constant techniques, a constant output coming from your CT scanner, the number will be half the value that you would have measured in a small phantom. And in my opinion, this is the only important relationship when it comes to the phantom size. And to illustrate that, let's consider a clinical example. Let us suppose that you do a head CT scan. You look at your operator's console and you learn that you use a CTDI vol of 60 milligray. This is the amount of radiation that you use to perform the exam. Now you scan a patient's neck region and you learn when you look at your operator's console that you used 11 milligray, but the measurements for neck phantoms on your scanners are normally reported in the large phantom. And the problem now is that you're not sure how much radiation you use for the neck region compared to the head region, because you simply cannot intercompare the CTDI numbers that are made or measurements that are made in large phantoms. But if you now go to the neck phantom scan and you said, I made a measurement of 11 milligray in a large phantom, I know if I'd made that measurement in a small phantom, the number would simply be twice as big, 22 milligray. And now you can directly compare the amount of radiation that you use for the head CT exam, 60 milligray, which is nearly 3 times larger than the radiation used to perform the neck exam. And this relationship between the large and small phantom, in my opinion, is the only important one, and it permits you to convert one phantom size measurement into the corresponding phantom size measurements. So, in axial CT, CTDI vol is directly proportional to the tube current, the MA. It is directly proportional to the tube rotation time, S, and it is therefore proportional to the MAS. In helical CT, CTDI vol is directly proportional to the MA, and if all the other parameters are kept constant, it is proportional to the X-ray tube rotation time, and it is inversely proportional to the pitch. Again, I emphasize that all the other parameters must be kept constant, and if that happens and you double the pitch, CTDI vol will be reduced to 1/2, and if you halve the pitch, CTDI vol will be doubled. So in helical CT, CTDI vol is actually proportional to the effective MAS. And let me remind you what the effective MAS is. It is the MAS that you have divided by the pitch. And on the kind of CT scanner that you have, what you have is you make use of the effective MAS. When you select an effective MAS and you change the pitch, the MAS will be changed accordingly. So it's the effective MAS, not the MAS, that is being kept constant. And this is a big advantage because image quality is much more closely related to the effective MAS as defined by this equation here than it is to the actual MAS that you chose. Now when we look at the KV relationship, I'm showing you here measurements of vertically the CTDI vol value, horizontally the X-ray tube voltage value. Notice that the head phantom values at a given KV are approximately twice the body phantom measurements, And notice that the relationship is not linear, it's what physicists call supralinear. And you can show that CTDI vol is proportional to kV to the power 2.6. And let me illustrate what that means in practice. Let us suppose you change the X-ray tube voltage from 80 kV to 140 kV. And furthermore, that you keep everything else constant. What you will find is that CTDI metrics, CTDI vol and DLP, will increase by over 400%. And this is a reflection of this kV to the power 2.6. And it also teaches you that the choice of kV is a very important determinant of the amount of radiation that you will impart to patients undergoing your exams. And if you can configure to drop X-ray tube voltages, you have the potential of reducing patient doses and reducing them substantially. CTDI vol is a metric that I like to use when I quantify how much radiation comes out of a CT scanner. I notice that many of my colleagues, whether they're radiologists or technologists, like to tell me about the MAS that they use. Now these two are related to each other, so in principle you should be able to use both. But let me show you an example. Let us suppose that you use 400 MAS on this particular CT scanner. At 120 kV, the amount of radiation that comes out when measured in a CTDI dosimetry phantom is 60 milligray, but if you change the X-ray tube voltage, it drops by nearly a factor of 3 down to 21 milligray. And so what this teaches me is that if I tell you that I use 400 MAS, without understanding the other parameters, I'm really not sure how much radiation was being used. But if I tell you CTDI vol, you know exactly how much radiation was used to perform the exam. And I can generalize that and explain that CTDI vol is a universal metric. You can do your scan on any kind of scanner in any part of the world, and if you tell me that CTDI vol in a small phantom is 60 milligray for a head CT scan, I know exactly what you mean. And it does not matter on the voltage that was used, it does not matter on the choice of beam shaping filter, whether it's a head or a body or a pediatric, it doesn't matter on the type of CT scanner you're using, and it doesn't matter on your vendor. And I really want to encourage you to get into the habit of specifying the amount of radiation used to perform an exam in terms of a CTDI vol, which is a wonderful universal metric, and I would urge you not to use the MAS. If you tell me that you use 400 MAS without knowing the kV and the model and the filter and the vendor, it really is not very helpful. Okay, the third and final part of part one is how can we make use of these numbers, the CTDI vol and DLP, to tell us about what the patient receives. And the first thing I want to emphasize is that CTDI vol is the radiation incident on the patient. It is not the patient dose. Consider a scan where you have a CT output of 20 milligray. You can place on the table a newborn infant or an oversized sumo wrestler. For the same incident amount of radiation, the newborn infant doses will be really quite large, whereas the sumo wrestler, because of the sizable attenuation and the dilution of the absorbed energy in a huge mass, their doses will be much lower. So you cannot take CTDI vol as any kind of indicator of the patient dose, but you can convert these numbers into quantities that tell you what the patient absorbs. Now sometimes we're interested in a specific organ. A pregnant woman, for example, you're interested in the embryo or fetal dose. In a head CT scan, you might be interested in the eye lens dose. And you're interested in organ doses because they help you to predict the corresponding organ risk. And to obtain an organ dose, you must take into account how much radiation you're using. That's the total CTDI, which relates to the incident radiation. You take into account a patient size factor, and you take into account a scan length factor that tells you how much of the organ was actually irradiated. And I have a publication in the American Journal of Röntgenology, volume 194, published in 2010, that explains in detail how you can get an embryo dose in any body CT scan. And if you follow this methodology, you do an abdominal pelvic scan of a patient who's pregnant. The CTDI vol that you use is 20 milligray. And let's assume that this is a normal size patient with an AP dimension of 22 centimeters or so. The resultant absorbed dose to the fetus is 28 milligray. Now you notice that here I use CTDI vol, and there is a good reason for this. If you had added a chest scan to this abdomen pelvic scan, that would not change the fetal dose significantly, but it would have increased the DLP. So organ doses are obtained from CTDI vol, whereas the total dose the patient receives, the effective dose, is related to the dose length product. Now the effective dose is a very useful metric. In North America, where I live, we get about 3 millisieverts per year. We get it from cosmic radiation, from terrestrial radioactivity, from primordial radionuclides incorporated into our bodies, and also from radon and radon daughters. And as I say, 3 millisieverts is the typical average effective dose to an American, and the effective dose is a measure of the total amount of radiation your patients receive. And you can estimate an effective dose for a normal size adult using this equation. The effective dose E is a product of the dose length product and a K factor. And I recently published some K factors. The title of the paper is CT effective dose per dose length product. It's in the journal Medical Physics, published in 2011. Volume is 38, and these are the page numbers 1261 to 1265. And let me show you how you would use these K factors. You do an adult head CT examination. You have a CTDI vol of 60 milligray. You multiply the CTDI vol by the scan length and you get the total amount of radiation used. You take a typical K factor for adults undergoing head, 0.002 millisieverts per milligray centimeter, and your patient effective dose is 2 millisieverts. If instead of scanning an adult head, you had done a 1-year-old head, then your CTDI vol might have been 30 milligray. The DLP might well have been 360 milligray centimeters. Notice that the K factor for a child is different from the K factor for an adult. Here 0.005 millisieverts per milligray centimeter, and the bottom line effective dose is 1.8 millisieverts. And the final example I want to show you is an adult chest. And again, let us assume that this is a standard size adult with an AP dimension of, let's say, 22 centimeters. You use a CTDI vol of 7.5 milligray. You take into account the scan length to get a DLP of 150 milligray centimeters. Now notice that the K factor for normal size adult chest is 0.02 millisieverts per milligray centimeter, and you get an effective dose of 3 millisieverts. So you can get organ doses, you can get effective doses in normal size adults, but what if your adult patient is not a normal size adult? You may have a small patient or you may have a large patient. in which case you have to use an adult body size correction factor as shown here. When you have a constant amount of radiation that you use to perform a scan, so CTDI vol and DLP are fixed and constant, for a normal size patient with a body dimension, an AP dimension of let's say 22 centimeters, the relative dose is 1. If for these same techniques you scanned a smaller patient, the dose would increase. In a 16 centimeter AP dimension would result in a dose that might be 25% or so higher than a normal size adult. And if you scanned an oversized patient with an AP dimension of 30 centimeters, you would find that the relative dose might be 65%. So you can in fact take into account the size of the patient who's being scanned. So let us review what we have covered in part 1. We have covered the issue of CT dose. CTDI vol is the radiation intensity, and DLP is the total amount of radiation that is used to perform a CT scan. They are not the patient dose. CTDI vol is directly proportional to the MAS in an axial CT scan, the effective MAS in a helical CT scan, and proportional to kV to the power 2.6. So it is more than kV squared, but not quite as much as kV cubed. And if you're interested in the patient dose, CTDI vol and DLP are your starting points. To estimate an organ dose, you have to take into account the total CTDI vol that was being used, and you can use this to get the organ dose. To get the effective dose takes into account all the organs and tissues that were irradiated. You make use of the total DLP used to perform the examination. So we have now covered the X-ray radiation part of a CT scanner, and in part 2 we will address the very important topic of image quality in CT imaging.